Thank you, Mr. Chairman. Members, my name is Ware Wendell. I'm the Executive Director of Texas Watch. We are opposed to the bill.
Thank you.
For over 20 years, Texas Watch has advocated on behalf of patients on issues related to patient safety, patient care, and that's where I'd like to spend my time this evening in focusing us on patients. We have a real problem in Texas when it comes to patient access. I want to give you a couple of data points that you haven't heard already in this very long day. In 2017, Merritt Hawkins, an independent consulting group, medical consulting group, ranked us 47th in the country in terms of patient access. In 2020, another independent analysis had us listed at 48th. 1 in 5 Texan adults do not have health care at all. We are worst in the nation when it comes to the rate of uninsured Texans. So I just want to start by saying thank you to the doctors who've testified, who've taken time out of their days and their practices. Thank you for the care that they render to folks, because we need more of that care in this state. We don't need more hurdles. We don't need more obstacles. We don't need more red tape for these doctors. Milton Friedman said accurately, there's no such thing as a free lunch. But I submit to you, in this bill, we have a free shot in terms of the notice of intent to contradict or controvert medical costs. There's no real cost for the defense. It's been described as even an email may suffice. And so what's good for the goose is good for the gander. If one side needs to put up an affidavit, the other side should put up an affidavit. If we need to work on that area of the law, maybe that's where the committee might want to train its attention. Because we're distorting market dynamics here, I also would like to caution the committee that we may unintentionally create a new balanced billing situation here if you stop and think about it, because the bill effectively caps medical bills, the recovery of medical bills, but not the medical charges themselves, what may come later in time for that patient. If people cannot receive care, whether they have insurance or they don't have insurance because of the opportunity costs, the transaction costs that are imposed on these medical providers under the bill, they're going to have to receive their care through emergency rooms, through county hospitals. Who pays? We pay as the taxpayer. The wrongdoers here are socializing their costs. And so I really caution this committee to not walk down this road, because we may create a new class of untouchables here in terms of injury victims. And we need more care in this state, not less care. Happy to take any questions.
Thank you, Ware. Any questions? No, thank you. I know you are very concerned about healthcare access and healthcare policy. I'd encourage you to watch the press conference there's going to be tomorrow that Dr. Bond and several other House members are going to be participating in, rolling out some healthcare policies from the House. I think you'll really appreciate what you hear.
Thank you, Mr. Chairman.
Thank you.